right, welcome back to the Dr. Des Show. Today we are talking all about my doctorate in public health. So if you are considering getting a doctorate degree, or if you are already in the struggle, my friend, then this episode is for you. So if you don't know, a doctorate in public health is a DRPH. So I have a DRPH, not a PhD. A DRPH is more of a practice-based doctorate. So by practice-based, meaning I didn't want to go do research. I didn't want to go teach at a university after my degree. I wanted to actually practice and work in the field of public health. Now, you can do either with both degrees, but that is the main premise of why I chose to get a DRPH over a PhD. But we're going to talk all about that today. We're going to talk about my journey to getting the DRPH, the funding, what that looked like, and just kind of answering that question of, should you get a doctorate degree or not? So we're talking all about that today. So a DRPH focuses more in on leadership, practice-based, applied practice in public health, right? Now, I said earlier that you could literally do either or with a PhD or a DRPH, and that is so true. I'm also an adjunct professor, so having a DRPH does not preclude me from teaching. I still teach, right? If I wanted to do research, go into more of a research-based role at a university, then I could still do that too. So it doesn't keep you from doing either or. I've also worked with people with PhDs who work in the field, who do all of these amazing things. So one doesn't keep you from doing the other. Now, some differences that I will make sure to point out to you guys. Number one thing that I know y'all care about the most, the money, right? With the PhD, most of the PhD programs are going to be funded, right? If you're going for a PhD, then those programs are usually fully funded. And I want you to make sure, now, listen to me when I say this. If you are going to get a PhD, make sure it is fully funded, okay? The money is there. So don't play around, okay? So I want to make sure that you guys know that. Now, DRPHs, they are funded too, right? Mine was fully funded through the McKnight Doctoral Fellowship. Now, I don't think they offer that anymore for DRPH students. They just do it for PhD students, and you do have to go to an eligible school in Florida, right? So I went to Florida A&M University for my doctorate, and that is how I was able to get it fully funded at the time. I applied for the McKnight Doctoral Fellowship, and I got it. And they paid for all of my tuition for all the years that I was there, and they gave me a $6,000 per semester stipend, right? Now, with that stipend, yeah, that was great, but your girl still worked full time while I was in my doctorate program and in my master's program too. So I still worked full time. And actually, when I was in my master's program, probably like the last 2 semesters, a few months before graduation, was when I got my first, I call it my career starting job at the Florida Department of Health, doing heart disease program management. So I got that job, and I was like, okay, I want to make sure that I keep this job, because remember, if I'm getting a DRPH and I want to actually practice in the field and be a leader in the field, I got to have some experience coming out. That is one of the mistakes that I think a lot of people make when they go and they get these degrees back to back. You forget about having experience. So then you get mad that you ain't got no job and ain't nobody want to hire you because you got all this education but no experience. So you got to get experience first before you're saying that, you want a job, especially a job making the money that you want to make with a doctorate. You need to have experience first. And sometimes that may look like you having to work full time or work at least part time while you are in a doctoral program. So working all throughout my program, number one, I had to live, because I couldn't live off $6,000 a semester, right? That's like what, $6,000 every 4 months or so. Who was living off of that? I had rent to pay, I had groceries, I had a lifestyle to maintain. So I needed a job, right? And, I needed health insurance, I needed all of that stuff. So I was able to say, okay, I'm going to do this. And luckily, I had my boss who was okay with me having a flexible schedule, because my classes were not all in the evening. I had some 9 a.m. classes and everything, but my boss was able to let me flex my schedule out, because I was open and I was honest and I was upfront to say, hey, I'm going to get a doctorate. And they were able to do that for me. Now, also, Another way, a little hack to kind of pay for school, if you do live in Florida now, I don't know, this can go for my people in other states too, but I know if you do live in Florida and you work for state government full time, if you're FTE though with state government, they will pay for up to 6 credit hours per semester of, whatever degree that you're getting. So if you're getting that master's, that doctorate, whatever, they will pay for up to 6 credit hours, okay? So that is another hack too. So if I didn't have like the McKnight Fellowship, then I would have definitely took advantage of them paying for 6 credit hours for me, right? And a lot of my friends and colleagues, they did. They took advantage of that. So make sure, and some jobs too provide tuition reimbursement. So if you want to get out there, get that experience, get that doctorate, look into what these jobs are offering, right? Don't just look at the salary. I always tell people, look at the full benefit package, because that could look like, what does the health insurance look like? What does the bonus look like, right? I've been in a job where I would get a yearly bonus that was 10% of my yearly salary. So what does that look like, right? I've even had a friend, he told me that he actually gets a quarterly bonus from his job. And I was like, oh, quarterly bonus? Where do they do that at? Like, but that was really eye-opening for me to understand that. But a lot of them will pay for your tuition too. They will reimburse you for tuition. So you will get paid to, you will be able to go to school for free. And I think that's something to definitely take into account. Now, will it be hard? Yes. But it will definitely be worth it, especially when you can come out of a doctorate and say, all right, I have a doctorate. I also got 4 years of experience. Now I'm ready for this director level role. Now I'm ready for this more leadership level role, and I'm ready to make the money that I know I deserve to be making. So I was able to do that. Now, I did not have kids or a husband at the time. So if you do got kids and you're married, like that's something else to consider too, because it's a lot and you get stressed, you get burnt out. Listen, that's why I got on my shirt that says fear not, Isaiah 41:10, because don't fear it, but you gotta go with God on getting that doctorate and working full time and doing all these things, especially if you got a kid. It is 100% doable. I had people in my program with me that had families, right? There were a lot of people that were older and had families, so it is not something that you can't do, okay? So I want to make sure that I stress that you can do it, all right? It can be done, and it has been done before. So one of the things that I dealt with when I was in my doctorate was burnout. So I will say, I had someone ask me the other day, Dr. Des, what advice do you have for somebody getting their doctorate or just starting, that is about to be in their first year of their doctoral program? And my advice was, number one, your first year, you're just taking classes. It's literally just a continuation of your master's degree, whatever. The classes are no harder. It's school. You're in school, right? You got to write papers, take tests, do all of that. So don't fear that. Now, what really got me was when I finished all of my classes, I was so burnt out. Like I was stressed, I was burnt out, like I couldn't even think, right? And once I finished my classes, I had to do my qualifying exams. So we had to do all of this, like just studying of all of the different classes that we've had up until that point, to take this one test to say, okay, now you qualify, now you can go into the dissertation phase. So in taking that, like after I took that and passed, me and my friend Jana, we couldn't even look at a book again, right? So we were both working full time while we were getting our doctorates, right? So we both just commiserated together. So it's important to have a friend to commiserate with you and to understand the struggle with you, right? And to study with you, because we had some late nights on campus and early mornings going to work at 8 a.m., right? So we leave campus at 3 a.m., then head back to work. See you work at 8. But doing all of that, we got so burnt out that last semester before we started our dissertation that we just had to take a break. So after we finished those qualifying exams, or we call them comp exams, actually comprehensive exams. Depending on what school you go to, they may be qualifying, they may be comprehensive. But it means essentially the same thing. But after we did that, we just said, we're going to take a break. we're going to take a break. We about to go travel a little bit. So we would go to DC, we'd be in Atlanta, we'd be just all these places, just honestly, just going out, having fun. Now, my advisor was asking me to write, but I was like, I'll write soon. Like I wrote a little bit, but honestly, I was just not in it, right? I was not in it. And y'all, I was still working. Now we still working full time, but we took the rest of that semester and just reprioritize and focus in on what we needed, right? And we just needed a break. And we did that. We traveled, we had fun, we laughed. And when we came back that next semester was that summer semester, we got to it. We were writing and we were ready to go. Now, one of the hardest parts I always tell people too is one, dealing with that burnout. And two, I will say the dissertation phase. The classes, like I said, they're just classes, y'all. So don't be intimidated by the classes and the schoolwork. You've done that before. Now, the dissertation, that was one of the hardest things, and mainly because you are on your own doing that, right? There is no, oh, you got a deadline to meet with this. You got a test to take with this. You have to do your own schedule. You have to figure it out, right? Now you have your advisor that is there to help you. She's there to push you. She or he is there to push you and there to, help you get a timeline together, get stuff in, get stuff submitted, and help you graduate. But at the end of the day, you are doing a lot of independent research, independent studying, and it is definitely a switch, right, that you have to think about. So when I first started, I would say I wouldn't call this bad advice that I got, but it was advice that just didn't work for me. But it has worked for some people. Now, one of my mentors, she told me, she said, Des, focus in on a topic that you actually do at work, because at work you got all the data that you need. You're already doing it. You already know it. So just do that for your dissertation so you can get up out of there, because at the end of the day, your dissertation is not going to change the world. You just trying to graduate, okay? You trying to make a little dent, little impact in something, and you're trying to graduate. So just remember that. You ain't trying to change the world. You ain't trying to, you ain't trying to do all of this. You're just trying to graduate, okay? Now, I kept that in mind and I was like, all right, let me do this topic on heart disease. Since I work in heart disease, I wrote a whole, concept paper, but it was trash. Like, it was definitely trash. Like, I wasn't feeling it. And honestly, I felt like when I would go home, I was still at work, because now I got to work on this and it's the same thing I'm working on at work. So it was like I'm never ending at being at work. So I was just like, all right, let me pivot my topic. I am interested in maternal and child health. I'm interested in pregnancy. Like, I'm interested in all these topics. So let me pivot to focus in on that. So I pivoted, and my dissertation topic was paternal involvement in during pregnancy. And basically I explored how African American men felt about pregnancy and about their role within pregnancy. And when I tell you, that was probably the best thing that I could have done, was pivot and switch to that, because I started writing and it started flowing, right? And I was interested in it and I was learning things and I was like, wow, this is so cool. This is great. So that was good for me. Now, whatever works for you guys when you're doing your dissertation, that's fine. Whatever works. Do whatever works that's going to help you to graduate, and you're not going to get bored. You are not going to, eventually you're going to hate it. You're going to feel like what you're writing is trash or whatever. Keep going. All right. Let your advisor tell you that it's trash. All right. You don't tell yourself that. I was telling my friend the other day, I was like, yeah, just turn it in. Turn in what you got, and your advisor will tell you if it's trash or not. And you go from there. Like, you don't just keep delaying and delaying and delaying. Okay. So that is one of the big things. That is one of the things that I felt like was the hardest part of getting a doctorate, is going through that, dealing with that burnout, and then trying to figure out that dissertation process. Now, always make sure too that, and it's kind of hard, but make sure you got a good advisor. Make sure that you have an advisor that will hold you accountable. Now, I had an amazing advisor who I still talk to this day, and she was just awesome in helping me get a schedule together, helping me to write, helping me to understand all of the things that I needed to do. And it helped the process go by so much better when I had a great advisor, right? So make sure that you have that. Research all of these professors and really kind of, ask if you can have this particular one as your advisor. It doesn't hurt to ask. They might tell you no, but it does not hurt to ask, right? Now, one of the things that I would tell you guys, like I tried to get away with that I did not get away with, she caught me, was I originally said I was going to do a mixed method study. And for my people who don't know what a mixed method study is, that meant that I'm going to develop a survey, analyze like the data in that survey, analyze the data, and then, but I'm also going to do something like a focus group. So I'm going to go out and talk to people and get some qualitative information on top of like all the numbers and statistics and stuff. So I'm going to go talk to people. I'm going to do this. I tried to not do the focus group part because I was like, man, I'm tired. I'm just ready to graduate. It was getting closer to the time I needed to present my research and everything. And I was like, I'm just not going to say nothing. I'm not going to mention it. And she called me out. She was just like, we had a meeting and she was like, yeah, this all looks great. It's good to go. But didn't you say you were gonna do a focus group? I said, huh? And she was like, yeah, didn't you say you was gonna do that? And I was like, I mean, I said it, but do I need to? And she was like, yeah, you need to. And when I tell you I did it, I moaned and groaned, but I did it. And honestly, that was probably my favorite part of my research that I did because I was actually able to talk to men and women and really get their views, their opinions, their thoughts. I talked to people from various age ranges too. So from like 18, and I talked to people like that were in their 50s who have been through pregnancies with like their wives and stuff like that. So, and it was just very interesting to talk to them to get their insight and their perspective on what their role should be during pregnancy. And one of the main things that kind of came out of that was just knowing that like a lot of the dads just didn't know like what they should be doing, how they should help and different things like that. So in turn, that kind of helped me with dealing with my pregnancy in that like I was like, all right, I want to make sure I have a doula because I want to make sure that my husband can be involved in the pregnancy and I want to make sure he knows what to do. So like I wrote him a list of things like, when I go into labor, here's that list of what I need you to do and what you can support. And the doula really helped him to do some different things like doing counter pressure on my back when I was having a contraction to help me. So he immediately knew to do that for me. So he had his role and he knew what role he had to play because I was able to do my research and understand that, okay, men, they just don't know a lot of times. And so I was able to make sure that he felt included and that he knew what he was doing and how he could best help me to bring our daughter into the world. But the dissertation helped with real life. I went off on a little tangent, but the dissertation definitely helped with real life things. But do something that you're interested in, that you're passionate about, because a lot of times, we do public health because we're passionate about it, because we love it, we enjoy it. But do something that interests you. And remember, you ain't trying to solve the world's problem. You're just trying to graduate. All right. So the last thing I want to discuss is, should you get a doctorate? So now we kind of talked about a lot of different points. I took you through the journey. But I want to really help you guys come to that conclusion for yourself on, should you get a DRPH? Should you get a PhD? Or should you just stay with your master's? Or should you just stay with your bachelor's or whatever? Whatever works for you. Now, don't get a doctorate if you don't know what you want to do with it, right? If you just know, I want to go to school, I want to be a doctor, that is a lot of money to waste, a lot of time to waste to not know what you want to do, okay? Have a clear plan before you go into that, all right? Because if you just want to make six figures in your career, you can do that without a doctorate. You can do that with a master's degree, right? You can make money with that. It's all about leveraging your network, leveraging your resources, and really just kind of pivoting into different sectors within public health, which I teach a lot about in the public health club. So there are workshops in how you can pivot into tech, how you can pivot into biopharmaceutical industries, like all of these different areas that need public health professionals, but we're just not exposed to them. So if your goal is to say, I want to make six figures, so I'm gonna get a doctorate, that you can do it, but that may not be the best reason to do it, okay? The next thing to think about is, do you want a leadership role? Now, you can have a leadership role without a doctorate. You definitely can. There are people that do it all the time. But understanding that the workforce is becoming more and more competitive. So if you do want to go to like a, let's say, director level role, VP role, all of those things within public health, then you may want to consider getting a doctorate at some point. It may not be now, it may be later on, but it may be something to consider. Like I said, you can do it without one, but having that doctorate is going to give you a little bit of leg up over the competition. The last thing to think about is if you're ready for that time commitment, because it is a time commitment, it is stressful, it is draining, but it's definitely worth it. I would definitely say it's worth it. I did my DRPH at FAMU, and I wanted to go to FAMU mainly because I wanted professors that looked like me. That's one reason. And then two, I wanted to focus in on health equity, on disparities, on underserved communities. I wanted to focus my work in on the environments that I came from, right? I wanted to be able to help those people that look like me, that came from environments that I did. And that is one of the things that I knew was a priority of FAMU. So if you are going to get a doctorate, make sure that you really research these schools and you really look at what the professors have researched. Their research is public a lot of times, right? So Google them, right? Look at what their research interests are, look at what the priorities of the school are, and really understand that so you can get in there and you can, know what you're gonna, not necessarily know what you're gonna study or know what your dissertation topic is gonna be, but you're gonna know like how they're gonna best help you to get to that next level of where you want to be in your career. All right. We just talked about a lot of stuff. So I hope I gave you guys a lot of different things to think about when it comes to getting a doctorate, whether you want to do a DRPH or a PhD. Main thing to remember is that if you know for sure you want to teach and you want to do research, do the PhD. Also, PhDs are more heavily funding. Now, that does not mean your DRPH won't be funded, but PhDs are more heavily funded. You're going to find a lot more funding for those. But always ask the university what they offer, what kind of scholarships and funding that they offer. But now, if you're still on the fence about deciding whether or not to get a DRPH or a PhD, then we have a workshop within the Public Health Club called DRPH versus PhD, where we had two DRPH professionals, we had two PhD professionals, and they talked about all the differences in those degrees. They talked about the career outlook, the salary outlook, and all of those different things. So make sure that you join the Public Health Club. If you haven't already, that resource is literally there waiting for you. We do mentorship sessions too within the club. So if you want some mentorship from me, go ahead and join the club. But all right, y'all. Happy studying for my people that are in your programs right now. Hopefully this motivated you a little bit or gave you a little bit of that push to say, all right, I just got to graduate. I didn't got to save the world. I just got to graduate. And if you're thinking about it, hopefully this gave you what you need. But all right, y'all, I will see you on the next episode. Bye.